welcome to the rounds. You are, besides the patient, Professor S.K. Nair, sir, and teach us how to examine a patient.
Thank you very much. Can I start, Dr. Mehra?
Sir, this is the first slide, sir.
Before I come to the first slide, I would like to thank Dr. Kaza for the profuse, somewhat overdrawn compliments that he's paid to me, but it brings back memories of what he has called the CPC, Clinical Pathological Consensus All India Institute.
That's
I
right.
don't know, I was a frequent target by the Institute, having served in the Institute previously for these CPCs. And I enjoyed doing these immensely. They used to send a brief history and about the patient and his progress, the laboratory findings, the x-rays, and then expect you to come to a diagnosis in a systematic manner. Before I go further, I'd just like to pay tribute to what I call the backroom boys. I used to bring those sheets, read them several times myself, and then I would distribute to several backroom boys, interns, house surgeons, postgraduates, and say, we will meet again after 2 or 3 days. Go to the library, look up things, please give me suggestions. And their inputs were so valuable that at least 8 or 9 times out of 10, we were able to hit the bullseye. My tribute to those backroom boys, wherever they are, however they are. Having said that, now Dr. Apu Mehra has chosen this subject, which I think really needs nothing new. What I'm going to say today is well known, publicized, accepted the world over. The only thing is that the manner in which it is implemented may have changed a little. Now, the first thing I want to say is number one slide, please, that your appearance is important. You see somebody who is showing signs of yawning, ruffled hair, unshaven, tobacco chewing, spitting. This does not carry a good impression. You must wear an apron, which is everyone knows, but pay some appearance to your appearance, unless there are very extenuating circumstances. You just may have come out of the OT, in which you can be in your OT dress, you may be having your cap, but your personal appearance is something that is very important. If you are yawning and showing such disrespect to the patient, it is not a good thing. It does not uh, get confidence for the patient. Next slide, please.
Sir, what about the smile on the face?
I'm coming to that. That'll be in one of the subsequent slides. Now, very often you see that doctors are examining a patient, the nurse is standing on the left, he's dictating instructions to the nurse, and several times I've seen you have your right foot or left foot on the patient's bed. Very, very condemnable. This is not the done thing. You may not believe it, but I've seen it more often than that. The old time feudal surgeons, as I call them, used to do it quite often. Some of them would even smoke while talking to the patient. This, I think, is a reprehensible practice. Be attentive, smile, and convey to the patient that you want to help. Your attitude is very important. If the patient thinks that while you are talking to her or examining him or her, you're talking to three other different people every now and then, giving the nurse instructions, receiving a phone call, giving instructions to your house surgeon. I think the patient thinks that he's just something which he doesn't care about. So while you're talking to the patient or examining the patient, be attentive, smile, and convey to the patient that you want to help. Next slide, please. Avoid harsh manner of speech. I think this is a given. I may not have included this slide, but having seen the feudal surgeons of the past, it may come as a surprise to today's young surgeons that surgeons did use very harsh manner, especially with patients who had come, say, from the villages. They would talk to him as if a landlord is talking to a peasant, which is very, very bad. You must talk to him in a very gentle manner. Use good terms, avoid a very harsh manner of speech. This is important. It enjoins the patient's confidence in you that here is somebody who is patient and listening to me. Next slide, please. Now, very often the patient has got a bed sheet on, and some surgeons they just pull down the sheet, strip it away, sort of tear it away from the patient. This is not the done thing. Please tell the patient herself, himself, to uncover the part of the body that you wish to examine. Patient may be sitting, lady may be wearing a blouse. You may want to examine the breast, the axilla, and that all requires that the patient must strip down to the waist. Never try to do it yourself. Get a nurse to do it, get the patient herself to do it. Because if you try to do what you should not do, I think it carries a very bad impression with the patient. If you can't do it, then let there be nurse to help. But doing it in a very harsh manner is not the done thing. Let the patient uncover himself or uncover herself the part of the body that you wish to examine. Next slide.